Assalamualaikum warahmatullahi wabarakatuh. Hello guys, we are from Group 3. We will present a reading text about stressor, coping mechanism, and motivation among healthcare workers in dealing with stress due to the COVID-19 pandemic.
Thank you for this opportunity. Okay, I will tell you about the connector, a descriptive analysis of 236 health workers working in health and centers, hospitals, and volunteers during the COVID-19 pandemic showed that the average age was 33 years, with an average work experience of 9 years. The majority of health workers are women, nurses, married, and live with family. Much health workers have received sufficient information related to COVID-19. Where more information is needed, it is obtained from social media or internet. The most prominent issues were related to the feeling of health work, feeling that they should do this job because it was their duty, and they fulfilled their ethical obligation. The most significant stress was the requirement to wear personal protective equipment or PPE daily. In contrast, the main factor that reduces their stress is that all health professionals work together at the forefront to cope with COVID-19. The three coping strategies most commonly used by health workers to deal with the COVID-19 outbreak are to adopt a positive attitude, to motivate themselves, read about COVID-19 and its prevention and transmission, and follow appropriate self-protection measures. Outbreak health workers in clinical setting have an important role in early detection and treatment of patients, so they are required to use PPE daily as the best protection of health workers. Discomfort using PPE includes adverse skin reaction, breathing difficulty, health stress, disease, and NASH. One of the strategies that can be done to solve this problem is to provide adequate PPE training to improve security and comfort. Thank you, and then the next will tell by my friend.
PPE daily as the best protection of health workers. Discomfort using PPE includes adverse skin reaction, breathing difficulty, health stress, disease, and NASH. One of the strategies that can be done to solve this problem is to provide adequate PPE training to improve security and comfort. Thank you, and then the next will tell by my friend.
Okay, I will continue the presentation from my friend. The government showed that the transmission of coronavirus in Indonesia is still occurring with the increasing case of COVID-19. Positive case of coronavirus or COVID-19 in Indonesia increased by 5,144 people. Thus, the total accumulative positive case of COVID-19 infection in Indonesia has reached 1,403,722 people. Active case of exposure to COVID-19 in Indonesia as of today there are 141,070 people, or 10% of the total confirmed infected with coronavirus. Although cases continue to grow, the government saw hope with the increase of 9,010 patients recovering from COVID-19 in a day. Thus, The total number of patients recovering from COVID-19 in Indonesia is now 1,266,673 people since the beginning of the pandemic. The central government has also started a national vaccination program. The target is that 188 million people will be injected with vaccine to create herd immunity. Health work and public service personnel are among the vaccination priority. The central government claimed PPKM Micro has managed to reduce the addition of daily positive cases. However, the community must always comply with health protocol on various occasions. Next will be explained by my friend. Thank you.
Okay, thank you for the time. Then I will read the next material. Role 2, Passage Picker. The first, the most significant stressor was the requirement to wear personal protective equipment or PPE every day. This is because there are new habits that are difficult to implement. Besides that, by using PPE, the activities of health workers are limited. The second is health workers are at the forefront of dealing with health problems due to the COVID-19 outbreak. Health workers have an obligation to provide health services during the COVID-19 pandemic. The reason is because health workers have their own ability to provide service in the midst of the COVID-19 pandemic. The third is it is important to recognize the health workers have been doing difficult and invaluable work during this time of the pandemic. The fourth is, however, using PPE every day causes discomfort, so it becomes a stressor for health workers. Discomfort from using PPE includes adverse skin reaction, respiratory difficulty, heat stress, dizziness, and nausea. The reason is because before the pandemic, they worked only in ordinary uniform, without any PPE as protection from the COVID-19 virus. Okay, the next material will be read by my friend.
Okay, and then I will tell about the summary. The result of research with descriptive analysis stated that most of the health workers state that their activities or work had been disrupted due to the outbreak of COVID-19. The most prominent result related to the feelings of the health workers felt that they had to do this work because it was their duty and they were fulfilling their ethical obligations. The most significant stressor was the requirement to wear personal protective equipment or PPE every day. Health workers are at the forefront of dealing with health problems due to the COVID-19 outbreak. Therefore, it is important to recognize that health workers have been doing difficult and invaluable work during this time of the pandemic. The three coping strategies most commonly used by health workers to deal with a COVID-19 outbreak were adopting a positive attitude to motivate themselves, 98.3%, reading about COVID-19 and its prevention and transmission, 98.3%, and following appropriate self-protection measures, mask, gown, 98.3%. Family support was a significant factor motivating health workers to deal with the COVID-19 outbreak, 98.7%. Their important role in the reducing stress for health workers are good collaboration between professionals, effective preventive measures, and a positive attitude when dealing with the pandemic. Okay, thank you, and then we'll continue by my friends.
Okay, thank you for the opportunity that has been given to me. I am a word wizard. In this reading text, I got some interesting words. For example, the first, I got PPE. PPE as a personal protective equipment. or in Indonesian is usually called alat pelindung diri or APD, is equipment worn to minimize exposure to hazard that cause serious workplace injuries and illness. These injuries and illness may result from contact with chemical, radiological, physical, electrical, mechanical, or other workplace hazard. During a pandemic, it is important for health workers to wear a kit to protect them from harm. The second, we have front lines. In a sentence of health professional works together and on the front lines to overcome COVID-19, it means the point is that health workers are the first to fight in dealing with the COVID-19 disease. The third, outbreak. In epidemiology, an outbreak is the sudden increase in occurrence of a disease in a particular time and place. It may affect a small and logical group or impact upon a thousand of people across an entire continent. For like a case of rare infectious disease may be suffice to constitute an outbreak. The fourth are skin reaction. The skin reaction is contact dermatitis is a reaction that appear when the skin comes in contact. The fifth, we have respiratory difficulty. Many breathing problems are long-term, chronic. These include chronic sinusitis, allergies, and asthma. They can cause symptoms such as nasal congestion, a run nose, itchy, or watery eyes. 6. We have heat stress. Heat stress includes a series of conditions where the body is under stress from overheating. Heat-related illness include heat cramps, heat exhaustion, heat rash, or heat stroke. The 7, dizziness. Dizziness is the feeling of being lightheaded, woozy, or unbalanced. It affects the sensory organs, specifically the eyes and ears. So it can sometimes cause fainting. Dizziness isn't disease, but rather a symptom of various disorder. The 8, nausea. Nausea is not a condition in itself, but mainly a symptom of underlying medical condition such as following: motion sickness, migraine headache, postural orthostatic hypotension, a decrease in blood pressure, and standing up from a sitting or laying position. The 9, coping mechanism. Coping mechanism are the strategies people often use in the face of stress and or trauma to help manage painful or difficult emotion. And 10, ethical obligation. Ethical obligation are a set up out to standard that define a moral course of action and draw a line between right and wrong. Okay, that's it. Furthermore, my friends will continue.
Okay, I will reading a question from our group. Question number 1. The text state the health word stressor are referred to your APD. In your opinions, is it the category of like stress or normal or heavy? Question number 2. What is the health word and coping mechanism? What is the adaptive or maladaptive mechanism? Give a reason and influence on patient service, please. Okay, next, question number 3. How do health work priority the quality of care service but also priority patient satisfaction and comfort. Okay, question number 4. Health workers cannot motivate themselves due to mental disorder and psychologists. How are the efforts of the government and COVID-19 office to prevent mental disorder and psychologists in health work? And last question. Okay, question number 5. How do you know that a health worker is experiencing stress? Okay, thank you.
Okay, their presentation from our group, and I will close our presentation. Thank you very much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.